All right. So, overcoming social anxiety. Elizabeth Miki Anderson. I go by Miki. I'm one of the pineapple support therapists. And I figured I should, show some professional background stuff. I've got my bachelor. I got 2 bachelor degrees at University of North Carolina at Greensboro. I have a master's degree in counseling. I'm a national certified counselor, a licensed clinical mental health counselor in North Carolina. I'm working on my PhD in counselor education and supervision. I currently have a lot of jobs to be working as a therapist, and very educated and very much in debt. And so some personal background, that's one thing. I am a mother of 2. I am amicably divorced and happily engaged, and I co-parent well with my kid's dad. I like making electronic music through a couple of apps. There's one called Launchpad, if anybody is interested in this sort of thing. I like singing mostly in my car lately because of the pandemic. That's difficult to do it much anywhere else. I'm into photography, spending time with my kids, my friends, and my fiance, and I deal with social anxiety. So I guess if at any point anyone wants to message in the chat, that's totally cool, and I'll look at it periodically. So introduction to social anxiety. Are you extremely afraid of being judged by others? Are you very self-conscious in everyday social situations? Do you avoid meeting new people? If so, and if you've been dealing with this for at least 6 months, you may have social anxiety. Like it may prevent you from doing everyday things. Okay, I'm sorry, I'm looking at the chat. It may stop you from doing everyday things like it says here, talking to people at work, at school, sometimes even making phone calls or pumping gas at a gas station. So some risk factors are inherited traits because anxiety disorders tend to run in families. It's not clear exactly how much genetics plays a role into it, but there's also your brain structure. Some people have an overactive amygdala, which plays a role in controlling the fear response. And environment can play a role where, if you're around people with social anxiety, then, you observe it and you kind of take that in. So social anxiety is a pretty common disorder. And there's some examples of symptoms of anxiety, such as meeting new people, dating, being on a job interview, or even preparing for one, answering questions in class. And here it says talking to a cashier in a store, but sometimes it's, like I mentioned, like, even if you're not even going into the store, just like if you're just at the gas station, having to be around other people, or maybe going in a store. But that's okay. So it's just that the fear that people with social anxiety disorder have in social situations, it's so strong that they feel it's beyond their ability to control. And so it gets in the way of work and spending time with friends, going to school. And some people may ruminate for days or weeks before a certain event, and they may find ways of getting out of these things. I'm not sure if anybody has any of these symptoms, such as blushing, sweating, rapid heart rate, feeling their mind going blank, or even feeling sick to their stomach, feeling, self-conscious and being afraid of of what other people are going to think of you. Excuse me. And then, you avoid those situations. Does anyone have any other signs that they'd like to add? I'll wait a couple of seconds. Oh yeah, fainting could be one. Yeah. Like, I imagine, like hyperventilating to the point where, you know, you're seeing spots and losing consciousness is definitely a sign. Anybody else want to share? Yeah, avoiding making decisions, because I mean, I imagine that it's something like, or I say I imagine, but for me personally, I have been known to avoid making, I've been known to avoid making decisions because it's, you know, you you think, well, what if I pick the wrong thing, and then this catastrophic something happens as a result. And the way I personally handle that, especially when it's a minute thing of like where to go, where to order food from, I just pick one. And I know that sounds oversimplifying it, but I tell myself it really is fine. So it's catching that self-talk, which I'll talk about later. But I'm reading that there's, you know, some people are dealing with tingling extremities or their body going numb, and I can understand, I can imagine that, and claustrophobia and just needing to be away from people. Like I can understand that, like if you're just in a large crowd and there's I'm reading in the subway, where there's like no exit, I can imagine that. Right, these are good ones. Thank you all for sharing. So what I had done for this for this presentation was I went around asking some people, because I know what, I mean, I know what the books say, I know what I've experienced, but sometimes people experience it differently. And I mean, even in the chat, you know, I'm finding that not everyone feels it the same way. So I asked some people, you know, if they felt comfortable sharing with me, and if they were comfortable with me, you know, providing anonymous, you know, quotes from them. And I found that for some people, social anxiety looks like anger and avoidance. And I had one person tell me that they can't enjoy living if they can't enjoy living in the moment. A lot of avoidance, a lot of overthinking, being overwhelmed, like with what should I be doing? How do I minimize the space I take? Am I getting in the way? Are they judging me? Just feeling overwhelmed. I like this one. Sometimes the thought of leaving the house, getting in the car. Sometimes just doing the thing, the social situation, like the event, whatever the thing is, what I say. It's not just one thing, it's breaking it down into smaller things. Like this person saying, I have to leave the house, I have to get in the car. But it's even before that, it's, okay, I got to get out of bed, I got to take a shower, I got to find the right clothes, I got to, you know, make sure that I leave on time. Do I need gas? Do I need to bring anything? And there's just all that overthinking, and it's understandable for people to just shut down and not go. And I would ask what social anxiety looks like to you, but I just asked that. But I mean, if anyone wants to share any more, then you're welcome, and I will look at the chat. So in talking to these people, I also asked how they cope with it. So one person talked about how they have support from their partner about, or from their therapist about self-care and like reaching out to friends. And it helps to be open with them, because then they know why, you know, they know what this person's going through. And letting her husband know is helpful for her. And having that support, I think, is helpful, because, you know, someone telling you just get over it, clearly that's not going to work. It's like, you know, just telling someone to calm down. I like this example of leaving a little early. Like if there's a major, like say you know, in a world where you can go to a concert, leaving a little early so that it's not as crowded when you get there, and telling yourself that, okay, when I leave, I'll just take my time leaving versus dealing with that cluster, you know, of people trying to exit. And this person does deep breathing to remain calm. One interesting with one person said that like they're able to overcome it when it comes to work, but when it comes to her personal life, it was like a matter of self-worth, where with the profession, like this person, it doesn't matter what this person does, but she, I mean, it matters. It's not relevant. So knowing that, okay, here's the thing that needs to get done, but then she doesn't feel that self-care and spending time with friends, you know, which I consider a form of self-care, is something she hasn't considered a need. She considers it something extra. So I think reworking that way of, I'm talking with my hands, but you can't see them. Let me adjust that. So I think, you know, just challenging that self-talk, it would go a long way. How would anyone like to share how they've overcome their social anxiety in the past? I'll give y'all a moment. And I guess, you know, I didn't include how I deal with it. I, like for this, I wrote notes for some things that I would say. I had a lot of fun putting this together, and I just kind of hyper focused on it. And I reached out to others asking, hey, how does this look? I mentioned going to get gas a lot. So I'll just, that was one of my things for a while, where I would put off like pumping gas. And I just got to the point where, because I had a particular gas station, but I was just, okay, well, today I will go to another gas station, and, or something like that. And I'm looking at the chat. Oh, fidget spinners. Yeah. Oh, a script. That's a good idea too. I had actually worked an office job about 10 or so years ago. And whenever I had to make calls, I would write on a sticky note what I had to say, because I had this intense fear that I was going to forget what I was going to say. And so, and sometimes I did, like I'd forget the number I was calling from when I had to leave a voice message. So I had to write that down. Yeah, I think it is good to be open about what you're experiencing, because then they understand what's going on. They know that you're not just avoiding them, that it's nothing like personal towards them, and they can be supportive instead of standoffish. Oh, I've never heard about using a spray bottle for like for panic attacks, but that makes sense, because sometimes slowly drinking cold water, or even holding something cold in your hands, can be helpful. It does something to like shock your system and bring you back to the current moment. Yeah, thank you all for sharing. Oh no, what's happening here? Oh, there's a comment that I forgot to approve here. Let me, excuse me. There might be a couple more of those that I didn't get. Oh, the vagus nerve. I actually don't know a lot about that. I'm reading the chat again. I like what Natasha said about leaving early. And yeah, like challenging those thoughts, like doing best and worst case scenarios before going in. I think that's really good, because your anxiety tells you, well, what if it goes horribly wrong? But then it's good to challenge that, like, well, what if everything goes right? And then, and you just kind of challenge that, and you're kind of retraining your brain to think that way, which is hard because it's, the way you think is a habit, and who knows how long, you've been thinking that way. So it's going to take a while to undo. But social anxiety treatments, there's therapy, there's support groups, and like medication management. I probably should have just put this bottom part in my speaker notes. But it's good to talk individually with someone, and like whether that's with a friend, but I think therapy is good just for the unbiased third party. And sometimes it's good to have a support group where you have people who have experienced what you've experienced. I actually went to a social anxiety support group, and there was a variety of people, but it took me a while to actually go, but I did go, and it was a lot of fun. This is some years back, like we were playing pool. I can't play pool, but I had fun anyway. And then there was another time we went to a pizza place, but I'm getting off topic. But it was good. Like there was like there was like a meetup group. So I guess it's really a meetup group, but there was a separate support group that was psychoeducational that I got a lot out of as well. But medication management, like if you feel that you can't, like say you're not ready for like a support group or any kind of outing, like it could be that maybe some medication would be helpful just to like get you to that baseline where you could expand on your comfort zone. Oh, I like what Natasha said in the chat about having a task to do. Yeah, like giving something to kind of like occupy your brain, if I'm understanding correctly. How to do the thing. So taking deep breaths, which I recognize is easier said than done, but like what I like to do, actually recently, let me fix this, downloaded an app called Calm, and it has, I love it so far. It has guided meditation. It even has music. They have playlists for morning coffee, going for a walk, stuff to help you fall asleep. And I mean, my life, I think I'm going to update this in case I use it again. My Life and Calm. Because my life is free. Calm, I'm paying a subscription for. I don't know if it has a free option. I usually prefer to give people free options because I'm nitpicky right now. I usually like to give people free options because even when it's like $2, I just when it's just a small amount, I don't know, it's enough of a deterrent for me to think I can find something else. So I just imagine other people are the same way. Allowing yourself to feel anxious, reaching out to your support system, practicing positive self-talk, challenging those thoughts, making small goals, like going to an event, a party, whatever, for half an hour, and then reevaluating, checking in with yourself to see how you feel. Practice realistic expectations, excuse me, which is one that I've practiced, especially because I feel like a lot of people have this unwritten rule or expectation that everything must go right. And and there's no room for error. And then if anything goes wrong, it feels catastrophic. Oh, cool. So Carolina mentions allowing oneself to fail. Yeah, that goes along. Yeah. And Luna is talking about insight timer. Ooh. I'm going to take a moment to add that, and then I'll stop nitpicking. I'll have to check that out. And another one I use is when all else fails, have an exit strategy. So, okay, well, I'm going to go to this. I'm going to go to this dinner, but I have something planned afterwards. Whether that plan is to go home and binge watch my favorite show at the moment, or what, like I have a plan to do another thing, and so I can go in, expand my comfort zone, hopefully have a good time. And if not, either way, I did it, and then I can go home. So then I'm sorry about that. So a few of these I go into more detail with. So there's a grounding technique that I'm not sure if you all have heard of, but oh yeah, taking someone with you as a buffer. It's a good one, Natasha. Yeah, I really like this grounding technique where 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste, which I always find is a funny one, because usually you're not in a situation where you can taste something. And I don't, like if you're driving, don't lick your steering wheel unless you're into that sort of thing, and you can do it safely. But you just imagine it otherwise. And the order of those things doesn't really matter as much. It's just so long as you can focus on your senses and bring yourself into the current moment. Oh, 5 Alive. I guess I've heard it called a few different things that are escaping me right now, but I like that. And I know I mentioned earlier drinking cold water slowly and plunging your hands into ice water, splashing some on your face. I like the spritz, the little spray bottle idea. And there's this quote that cold water can break through dissociative feelings and offer immediate relief. So yeah. I'm going to stop apologizing for it. Allowing yourself to be anxious. And I know it sounds counterintuitive, but a lot of times they're intrusive. Like anxiety is intrusive. You're going to, like, it's like telling yourself, don't think of a pink elephant. You're going to think of the pink elephant. You're going to think of it even harder than if you had just allowed yourself to think of the pink elephant. So it's good to schedule some time in your day, whatever you can give, and just allow yourself to think of all those thoughts. And then, after that, telling yourself, okay, well, now I've spent 30 minutes thinking about what could possibly go wrong with my day. And now I'm going to, do the next thing. Yeah. And so somehow by allowing ourselves to do that, we actually reduce the anxiety. Positive self-talk, challenging your thoughts. I know that we beat ourselves up a lot. And sometimes you don't even know it until, it could be 10, 30 minutes that have passed. And you can find yourself just, I'll give a personal story. I had been working a job that I absolutely hated. And I don't work there anymore. And I'm a happier person, but I had done something wrong with paperwork, and I got a talking to about it, like some mistake I made. And rather than just thinking, oh, that sucks, let me fix it, I thought, oh, I'm so stupid. And I found out, I realized I was chanting it in my head And once I caught myself, I'm like, no, I'm not stupid. I know I'm not stupid. I have all these things to like, I have all this evidence to the contrary. What I did do is make a mistake. It got caught and I'm going to fix it. And so, and that was kind of a turning point for me in life where I was like, I just tried to catch myself, and eventually it got easier. I still have negative thoughts because I'm human, but it doesn't take me half an hour to realize that I'm doing it. Checking the chat again. Oh, cool. Thank you. So another thing to do to help with this is to just like consider your strengths or things that you're good at. A lot of times when I ask people in therapy, I tend to ask them during the first session. I just, they're kind of thrown on the spot and they can't think of anything, or they'll say, I'm nice. And I'll say, well, what do other people say about you? And then they'll say, oh, well, they say I'm funny, and then I'm a good friend, and then I'm supportive. And, but it's easier sometimes to just consider what other people say about you. And what I like to recommend to people is then writing those things down. And that's something that I've done for myself where like I've thought, okay, even at my lowest, what positive things can I think of myself? And then I write those down. I try to, it's good to write this when you're in a level-headed or more level-headed state, depending on, like, it's not good to write it when you're in a funk, because then you're not going to come up with much. But when you're feeling pretty level, writing down positive things. And you can even ask others, hey, what would you add to this list? And then you write them down. And then when you're feeling depressed or anxious, you can look at them. I have mine in my phone, but some people prefer writing it by hand, in which case you could write it by hand. And if you're someone like me who might lose that, you can take a picture of it and then it's still in your phone, but you also got the satisfaction of tangibly writing it out. And you'll know that these things are true because you're the one who wrote them. You wouldn't write them down if you didn't have some kind of agreement of what I'm trying to say, even if I can't think of how to say it. So why do the thing? Because it needs to be done for whatever reason. And because you'll most likely feel better afterwards. I know that if I talk myself out of, sometimes what talks me into doing something is knowing that if I talk myself out of it, I'm going to feel worse than if I just did it. So, and usually, maybe not every time, but usually I do feel good for having done whatever. I'll feel like the time I went to a different gas station, I felt proud of myself. And I told people, and some people were like, okay, that's great. That's a normal thing. And other people who really got it, they're like, great, you stepped out of your comfort zone, and those are more my people. I am checking the chat. Oh yeah, soft music, that would be good. I like that. Yeah, having ways of like breaking the ice, having some small talk. That's a good idea. So these quotes I have here are from some of the people that I spoke to. They feel proud of themselves, knowing that they're capable of overcoming. Some people, still need to recharge afterwards, but then processing, it helps them. And I had one person say it always gets better. So how do you all feel after pushing past your anxiety? Oh, I like these words: victorious, strong, proud, relief. Yeah. Capable, strong. Awesome. Incentivized. I like that. Yeah. Like it gives you reason to do it again. Um, this is actually my last slide, second to my slide. It just says thank you. Practicing self-compassion. Oh, I do. Oh, let me look at the chat and then I'll explain my last slide. Mary Lee says that she feels exhausted when with someone who doesn't understand the social anxiety. Yeah, it can definitely be frustrating. Because some people just, like you said, they just don't get it. And I mean, some people just aren't as empathetic as I feel they should be. And that is frustrating. But it's great that it feels empowering. So practicing self-compassion. Sometimes the anxiety wins. Like not every time, like just, but every once in a while, it's going to happen because you're human. Just like if you have depression, sometimes, it's difficult to get out of bed. Sometimes the sink is full of dirty dishes, or you haven't done laundry, or it's been a week since you washed your hair, or something like that. Sometimes, but remember that you're a person, and I'd actually seen a meme recently about your, like you give 100%, but each day that 100% looks different. Like what you're capable of each day is a little different. So if you don't set out to do exactly what you set out to do, if you fall short, it's okay to forgive yourself, and you always have an opportunity to try again. And thank you.